Hello, everyone. Thank you for joining us. We're just letting folks in, so we'll just give it another minute before we'll get started. But thank you. Thanks for joining us so far. But we're going to pause just a moment and let everyone join. Okay. All right. Well, we'll go ahead and get started. Good morning, good afternoon, good evening, wherever you're calling in from. Welcome to International Medical Corps' Summer Update. Today, we plan to look beyond the headlines to examine some of the lesser known crises that we work in, as well as how we're preparing for future challenges. I'm Rebecca Milner, International Medical Corps' Chief Advancement Officer, and I'd like to thank you for taking time to join us today and for your generous support. Many of you on the call have donated to our work over the years, and your generosity makes our work possible. Together, we make a real difference, so thank you. Because I know that you're busy and we're all busy, we're going to keep today's briefing to just 30 minutes. We'll be happy to take a few questions at the end of our conversation. So as we talk, please feel free to type your questions in the Zoom Q&A. And if we don't cover them during the course of our conversation, we'll do our best to get to them, or we'll follow up with you after our webinar. All of us who care about the suffering we see around us are very aware of and follow closely the higher profile crises of today, whether it's Gaza, Syria, Sudan, Ukraine. All of those are crises that we're very familiar with, and International Medical Corps is responding in all of those places. But we thought today it might be good to take a look beyond the headlines and to examine some of the underlying issues and challenges that are facing us right now, and how they could potentially turn into the high-profile crises of the future. So luckily today we have two of our expert colleagues with us. Please welcome Paula Olson, who has more than a decade of experience in the development and humanitarian sector. Paula directs International Medical Corps programs in 11 countries across West, Central, and Southern Africa, as well as Latin America. And we have Dr. John-Kall. Jill has spent a great deal of time in all of the places that we work in, and is our senior health advisor, providing hands-on support to our country teams. She also leads our technical team that focuses on providing high-quality health services to the people we serve. So welcome, Paula and Jill. We're so glad you're here. But Paula, let's go ahead and start with you. I'd like to start off by asking you about some of our responses to crises that may not be in the news headlines. Whether it's cholera in Chad, flooding in Venezuela, instability in northern Nigeria. I mean, there's a whole host of things that our colleagues are dealing with. Maybe you could start with an overview of some of these humanitarian crises that we don't hear much about, and how we're helping.
Thank you, Rebecca. And again, thank you for allowing me to be here to talk about these issues, again, in places where we don't really get to have that exposure. I've talked on previous discussions or calls about the spillover effects of the Sudan crisis. And we know that we're still seeing the ramifications of this ongoing conflict. And one of the big challenges we spoke about earlier, not only the political challenges, the economic challenges, we knew that pretty soon we would see some of the spillover effects that would cause complications when it comes to infectious disease. And so that's what we're seeing now. And I'd like to just take a moment to talk about what we're seeing in Chad, which is hosting many of the refugees that are coming across the border from Sudan. So International Medical Corps is actually present in the newest camp that was set up by UNHCR in June of 2024. It's called Dugi Camp, and it's located in Wadai province, which is on the eastern part of Chad. And this is a camp that was set up to house 50,000 individuals. And it's, again, being the newest camp, this is where they're directing a large inflow of Sudanese refugees that are crossing the border. We know since July of 2024, there was the emergence of a cholera outbreak in Sudan. And to date, it's affected 15 out of 18 of the states in Sudan. And it's now heading to be one of the worst public health crises in Sudan right now. Over 1 million, estimates between 1 million or 3 million children at risk as this continues to spread even to Khartoum in Sudan. So with large populations coming over the border, now we had our first cholera cases just recently. And on July 25th, the Ministry of Health, after a rapid response team was sent to Dughi Camp, which is where we are present, finally announced the outbreak of cholera in Chad. So International Medical Corps, being on the front lines here as a first responder, has already started treating patients. Our camp currently hosts just under 20,000 individuals, and that's about 6,300 households, roughly. So we are setting up a 10-tent cholera treatment unit. We currently have 42 patients that are hospitalized, 36 bed capacity, so we're quickly scaling up. And we should be able to host as many as 80 when that construction is complete. Again, the situation changes and it's very volatile, but because we are responding to this crisis and with the support of the government, we hope that we will be able to mitigate it in a way that, unfortunately, across the border, it hasn't been able to cease yet. Cholera, just to remind people, is a life-threatening disease when it's not treated, and it causes watery acute diarrhea and also rapid dehydration. So being able to get access to oral rehydration salts, points where you're able to do that and also seek care is extremely important. And rapid detection and the hours are critical. So this is what we're doing currently in Chad. It is rainy season, so we do expect with this type of waterborne disease that there could be spillover effects. And speaking of rainy season in general, we are seeing that across West and Central Africa. We're gearing up for that season, and flooding will be an issue. So in all cases, where it be Chad or Nigeria, Cameroon, Mali, this is the season where we're working very closely with the Ministry of Health to make sure that the sensitization is being done at the community level. We're already setting up stations and support at the hospital level, and we're working closely with any officials at the district's regional level to make sure that there's awareness. Again, shifting over to Latin America, because you mentioned it, and it's not a place where I think that we're hearing a lot about what's going on there. In June, there were a series of tropical waves that continue to bring heavy rainfall and widespread flooding to Venezuela. And this was across the southwestern border of Venezuela. And now heavy rainfall has continued to extend devastation to the southeastern region of the country. Our team between July 16th and the 21st, so just last week, held a rapid needs assessment in some of the main states that are impacted by this and that have been outlined by UNOCHA as areas with the lowest emergency levels to respond to this crisis. What we intend to do is to have a mobile medical unit set up and deployed to treat critical care and make sure that there's essential equipment, medicines, medical supplies, and strengthen healthcare systems. So we'll continue to be working in that area, but this is something, again, that there's not a lot of visibility on. We can't fully assess the level of devastation that this is going to cause. So we're constantly working with partners and hoping that we can illuminate a little bit more and highlight the efforts that will be needed in the long term in Venezuela.
Yeah, I mean, you mentioned both Chad and Venezuela, and the impact of the inflow of people into Chad. It's because of the conflict in Sudan, but the conflict in that area has been kind of going on for decades, and people have been moving. Chadians have moved to Sudan and coming back, and et cetera. And the same thing is true in Venezuela. Repeated like economic shocks, natural disasters, et cetera. And Jill, maybe you could talk a little bit about how we help both individuals and communities recover from these sort of repeated shocks. I mean, we work in places where it's just kind of a constant refrain, right?
Yeah. Thanks, Rebecca. So you're right. Repeated disasters are different because of the compounding losses and the inability to fully recover. And that holds true for regions, for countries, communities, and even individual households. So people lose their loved ones, their breadwinners, their savings, assets, even their social support systems. And on a larger scale, they also lose access to services like health, education, water, electricity, and those kind of things. And on top of that, they also lose the health workforce because they might be injured or die in the disaster, or maybe they move because now there's nowhere to work anymore. And once that happens, then the community then no longer has a healthcare provider. And it's hard to come back from that. So people then start leaning on negative coping mechanisms like not seeking healthcare or taking their meds every other day because they can't afford it, or if it's maybe even not available. And then their governments are also at a loss because of the addition of any disaster basically means reduced resources for everything else. So, for example, in Ukraine, the current conflict is pulling away money and people from health services. Then that includes things like HIV testing and treatment, same for TB, routine vaccines for children, care for pregnant women, even something like running blood drives to make sure that there's adequate stocks on hand is really an impossible kind of thing to do. And that's in a country like Ukraine, which was a functioning European country before early 2022. But unfortunately, in other countries that may have weaker systems to begin with, a flood or a conflict could mean the inability to respond to an infectious disease outbreak that will take even more lives. When you factor in reduced funding, that really takes away the ability for people to prepare for disasters, to make their communities a bit more disaster proof to some extent. But as disasters get increasingly unpredictable, I think we can kind of lean on the work which we've always done to support preparedness, response, recovery, resilience. We've done a lot of capacity building in the past, capacity strengthening, and that's still the way we kind of operate. We help put those systems into place. We work at the community level to make sure individual households and communities have the ability to kind of still access healthcare services, to take care of themselves, to kind of prevent any kind of infectious diseases. We give them that kind of health and hygiene promotion. We also work a lot at the local level with governments and other local partners to set up the systems so that they can be prepared for disasters when they come. And that includes a lot of capacity building, and not just kind of capacity building in the sense of we do a training and then we leave, right? Because a lot of times just like one training is not enough. So what we do is we stay and we make sure that we give them supportive kind of supervision to make sure they're carrying out the protocols in the right way. Another thing people don't think about is, let's say if we provide an ultrasound machine, we also make sure that not only is someone there that can work it, but we also have to figure out who's going to take care of it, who's going to maintain it, who's going to repair it. I mean, that's where the sustainability comes from. Yeah, and we do all of that, so it's just, I think our pillars that we have been working in continue to kind of remain the right way to go because we've seen so much success in the past. And so whatever's coming up now, even though it's more unpredictable and all those kind of things, I think it still serves us very well that we can do service delivery and also like strengthen health systems and look at a more sustainable approach through localization.
Right. Well, I mean, you touched on all of these things. I mean, we are increasingly working in incredibly complex environments, right? They're the financial constraints, but it's all coupled with conflict, population displacements. I mean, extreme weather all over. I mean, you know, heat is something that we don't think about as a disaster, but these heat waves have been causing severe illness and, you know, having health impacts on people. And I mean, the spread of infectious diseases, and I mean, even I'm sorry, I can't even say this, antimicrobial resistance. I mean, things that, you know, we deal with in the United States, but that are actually real problems in some of the low-income countries that we work. I mean, Paula, maybe you could kind of talk a little bit about some of those complex environments that we don't often hear about, places, you know, like Mali's of the world.
Yeah, thanks, Rebecca. And I want to also continue to bring light to some of the things that Dr. Jill outlined when she spoke about the ways in which we support this. I mean, the environments are becoming more complex. We feel the interconnectedness of what's happening. It's real. I mean, just now, a quake in Russia is having impact on tsunamis in Japan and California.
Right.
We can't get away from the fact that in the complexities, we're actually becoming closer and closer to the reality of feeling the impact of this on a really real level. And some of the things that Dr. Jill was talking about, like the negative coping mechanisms, those could have really far-reaching impact on how we're able to combat disease, or we're able to combat some of these crises. So a lot of this is in making sure that we're building that community capacity and that resilience, and not always in the traditional ways that we're doing that. It's not getting easier, so we have to get smarter. And there are projects that we're putting into place right now. I want to talk about, you know, just quickly, the Learn Project. The Learn Project is a way in which we are building the next wave of outbreak response on a real level in places where it's going to have impact now. We're targeting countries like the DRC, Cameroon, Nigeria, Mali. These are places where at a regional level, if understanding the geopolitical situation will have large and far-reaching impacts on where we can go if we're trying to mitigate disease. And at the same time, we're leveraging our work in heat advisory, flood advisory at the same time, because those are all interconnected themes now that are becoming more and more important for us to tackle at the same time, and not, you know, afterwards or
Right.
sequentially. We need to do it at the same time. And this, I want to say, this has never been done before. In most of the countries that we're putting this outbreak response with national NGOs have never been leveraged in the way that we're trying to leverage them towards rapid response teams. They've never been included in the rapid response plan. It has always been the government ministries, and maybe international NGOs. So this is really exciting because we're thinking smarter. We're thinking how we can use what we've done at the community level for so long, building on that capacity, and then taking it a step further. So this is really what we're seeing. We're having to do more with less. That's the nature of the game right now. But the investments that we're making in that community outreach and meeting people where they are, that will have long impacts, you know, for years to come.
Right. Well, I mean, we've talked a lot about infectious disease outbreaks. I mean, Jill, maybe you could kind of give us an overview of some of the kind of disease outbreaks that are happening right now, but also some of the things that are emerging in places where we wouldn't normally expect them to be.
Sure. I mean, I realize I may be biased about this, but I do think this is one of the most important issues that we should keep on our radars. And I don't think a lot of people are really paying attention to it unless they see it on the news or social media, and then it's kind of gone in a blink because it's replaced by, you know, another news story, and then people forget. But, you know, when we think about the state of reemerging and emerging infectious diseases, it's something we should really be focused on, because especially since the drivers of these diseases, as you and Paula mentioned, are very interlinked, you know? So if we look at, for example, global events, just last month on July 24, WHO released a multi-country cholera outbreak kind of sitrep that highlighted that from January 1st of this year till June 29th, there was a cumulative total of 305 3,903 cholera cases, and 3,500 associated deaths. And that was reported from 28 different countries. And we're seeing cholera outbreaks, surging in recent years, especially in places like Ethiopia, Somalia, Nigeria, and of course in Chad, as Paula was mentioning, where we are responding. If you think back to last year, the recent Mpox outbreak, it actually involved 122 countries in total, including 115 countries where Mpox had never been reported before. We're seeing escalating cases of dengue transmission across Southeast Asia, Africa, the Pacific Islands, even the Americas. Europe is also seeing local transmission due to warmer temperatures and expanding, mosquito habitats and urbanization, which increase their water breeding sites and all that kind of stuff. And of course, we can't forget about the big three. There's HIV, AIDS, TB, malaria. Globally, HIV infections have declined, but not as steeply as we hoped. And still, there's more than 39 million people living with HIV globally. TB remains the world's second deadliest infectious disease after COVID-19, with over 10 million new TB cases diagnosed annually, with around 1.3 million deaths. But, we also have to take that with a grain of salt because you're also thinking about antimicrobial resistance and, extremely resistant TB and all those kind of things. Malaria gains have actually stalled, unfortunately, in the last few years. There's now about 250 million malaria cases globally, with more than 600,000 deaths. And all that sounds awful, but still it's kind of a little bit far away. But if we look in our own backyard, in the US, we've had Mpox cases in Georgia, New Hampshire, I think New York and Massachusetts. We've seen dengue cases in Puerto Rico, the US Virgin Islands, Florida, Texas, California, and even Hawaii. We're seeing major surges of measles in the US and in the UK. And, more than we have since like we were kids, for sure. There's a rise in, COVID cases in the US. And, we're now even hearing of cases of the plague in people and animals in places like New Mexico or Arizona. And these are the ones that we've heard about. There's also a lot of emerging infectious diseases too, like avian flu, primarily seen in Asia, Europe, and the Americas, with recent outbreaks in places like Cambodia, China, and the US. There's Nipah virus. There was Marburg, which caused outbreaks in Uganda and Ghana. And just last year, if you remember, Rwanda experienced its first ever Marburg outbreak. And then people are so focused on viruses, but there's also Candida auris, which is a multi-drug resistant fungal infection spreading in hospitals worldwide, including like India, Europe, and in the US. And in the US, there's been about 10,700 clinical cases recorded right here in the US in the last couple of years. When you think about infectious diseases, it's not necessarily a faraway thing that other people have.
Right. It goes to Paula's point
Yes,
about the world
exactly.
shrinking and we're so
Yeah,
close to each other now, right?
exactly. And, you both touched upon the drivers of these trends. So it can be, conflicts, environmental degradation, antimicrobial resistance. There's misinformation and distrust of science. And of course, there's critical funding cuts to, institutions and programs that support this kind of research, et cetera, et cetera. And there's a lot that we can do to mitigate these risks. And that's what we really do well, I think, So for example, we really support the One Health approach that integrates human, animal, and environmental health together. We support, stronger surveillance systems to improve early detection and containment. We provide rapid vaccine and drug development and deployment. And we also take part in a lot of global kind of forums so that we're kind of on the front lines of any new kind of information that comes out. And it also helps with coordination because the diseases that we're talking about are borderless, And so we're going to have to kind of coordinate it one way or the other. And going back to what I said, we also still kind of lean on our capacity strengthening and, work with local NGOs and other local partners to make sure that these steps that we take are actually sustainable in the long run.
Right. Well, I mean, I want to be cognizant of time. We just have a few minutes left. And if anyone has any further questions, please type them in the chat quickly. But I guess, I mean, we've talked about a lot of things and a lot of things that are going to have an impact on all of our futures. But you've also touched on how International Medical Corps is responding. I mean, maybe you could kind of give, just to end on a positive note, an example, Paula, an example, Jill, of what you think something really positive that we're doing in 2025 to kind of tackle these big issues. Paula, you want to start?
Sure. There's a lot of things to be positive about, and I know it can seem really scary and bleak. And this is why I tell my son, he's a toddler, so there's a lot that's outside of his control, but we focus on what we can control and what we can do. And there's a lot that we can do. And so I think a bright spot in 2025 and beyond really is that we're continuing to learn from the responses that we are putting into place. We're continuing to learn from the communities that we work with and work for. We are continuing to raise the bar in terms of the quality of our responses. And we're also looking at new ways to leverage that through technology, through AI, through new systems that we're putting into place. We were just talking about how our logistical capacity and our pharmaceutical capacity is growing through our application called PIMS. I spoke earlier about the Learn Project. I mean, that is a multi-country global response to tackle outbreaks and diseases. These are things that we are doing because we're thinking smarter about how we're going to reach that long-term mitigation and hopefully, solving some of these issues. I mean, we're going to continue to see displacement. There are going to be continued political issues, economic issues. But the one thing that we keep coming back to is that we are leveraging the knowledge and the capabilities of our communities. And that is going to continue to fuel the changes that we're trying to see globally.
Good. Jill, what do you think?
I think, and I can't say that this is specifically for this year, but I think one of the things that I am looking forward to is, although, I've repeatedly said today even that we lean on what we know how to do well, and I agree with that part at 100%, but we're also looking at innovation. So for example, we have the opportunity to partner with another company to look at using AI to diagnose TB through an app. And I think that would
be, as opposed to a blood test,
yes, exactly, and like sputum culturing and all that kind of stuff. But those kind of things will make life so much easier. We're also working with the Ministry of Health in Yemen to improve things like their maternal and neonatal mortality rates by putting in new advances, new technology, and maybe AI-driven ultrasounds and things like that. Which will make things a lot easier for us, and more importantly, more sustainable and easier for the countries that we work in and the people that we're helping out. So I think our kind of focus on innovation is also something that makes me happy, because I think this will eventually fall into a place where it won't be just us kind of saying, hey, this is a great innovative practice, but it'll just be taken up and it'll be sustainable and kind of their their usual way to go, so to speak.
Right. Well, fascinating conversation, lots to think about that you brought up, both Jill and Paula. Thank you so much for your time. And I just want to thank everybody on the call today. I mean, as I mentioned at the top of the call, I mean, your support helps make this work possible, and we couldn't do it without you. And so thank you very much. And we look forward to seeing you on our next call. Thank you, everyone. Bye.